The numbers are startling. 1 out of every 3 African-American women suffering in silence with fibroids. Across the country, an estimated 26 million women ages 15 to 50 have these non-cancerous tumors that grow in and on their uterus. They can cause heavy bleeding and lots of pain. I found there are a number of factors, including hair relaxers. Procedures just like this to shrink fibroids happen up to 6 times a day at Dr. John Lipman's Smyrna office.
Get the guide wires now on the left side.
Dr. Lipman tells me 90% of his clients are black women.
We don't know where fibroids come from, but they grow with estrogen. And if you look at the main ingredient in hair relaxers, it's biochemically almost identical to estrogen.
There's been limited research, including a black women's health study, that found fibroids were more common in women who use relaxers more frequently and use them long term.
Probably 80% of adult African-American women have fibroids. It's extremely common.
My mom had it. All of my sisters have fibroids. I have 3. I have a best friend that has fibroid.
36-year-old Tessa Taylor tells me she suffered with fibroids for years.
They told me that I had one big one that was 8 centimeters. And they were like, basically, I looked pregnant. I used to calling my fibroid baby, and that's abnormal.
Taylor was told she'd need a hysterectomy, surgery to remove her uterus, but Taylor opted instead for a uterine fibroid embolization procedure with Dr. Lipman.
And I don't know if you can see that.
UFE is non-surgical.
They're pretty hard to see, but there are hundreds of them.
Through a small incision, tiny particles are injected that block blood flow to fibroids, shrinking them.
And I can tell the difference because, I went from here to here, but I'm still expecting, my bleeding I'm at not even 50%. I would say like 90.
Taylor says with more women going natural, she doesn't believe relaxers are as much of a fibroid factor as diet. And Dr. Lipman agrees, saying African-American women can reduce fibroid risk factors by exercising, reaching a healthy weight, and adding vitamin D, a natural fibroid fighter.
We tell patients try to avoid, if they can, or if they can eliminate, some of the hormone-rich foods, red meat, non-organic chicken, dairy. Try to increase the amount of colored fruits and vegetables. They have flavonoids in them, which block an important enzyme in estrogen production.
So there are some things you can do. Now, studies have shown that nearly 90% of women who undergo a UFE procedure do have significant or complete resolution of their fibroid-related symptoms.